So the first question, Pradhan Mantri Jan Aarogya Yojana is a government's initiative to provide healthcare access to the economically backward and weaker sections. So it is a government initiative, and it is Pradhan Mantri Jan Aarogya Yojana for health to provide healthcare access to the economically backward and weaker section of the society, and represents a quantum leap towards India achieving universal healthcare. Explain the initiative and examine issues that are critical for the scheme success. 250 words. So explain the initiative and examine the issue that are critical for the scheme success. So it is the answer given by Monish Pandey. So thank you, Monish. Now study. Recently, Pradhan Mantri Jan Aarogya Yojana has been launched to ensure the healthcare is easily accessible, affordable, and available to all. There are two pillars of this scheme: Ayushman Bharat to combat the 1.5 lakhs sub-centers into the health and wellness center to provide maternal and mental care treatment, to reduce the burden on secondary and tertiary hospitalization. National Health Protection Mission, and first is, so here Pradhan Mantri PMJAY Pradhan Mantri Jan Aarogya Yojana, there you have two pillars. There are two pillars. Ayushman Bharat to convert the 1.5 lakh sub centers. So it is we discuss to reduce the burden of secondary and tertiary hospitalization, to provide maternal and mental care treatment. And second is National Health Protection Mission, NHPM. The National Health Protection Mission, it will cover insurance up to 5 lakhs per family per year. There is no cap on family size. The beneficiary will be identified by socio-economic caste census, and it will made out of pocket expenses and catastrophic health related emergencies to the poor sections. It will cover more than 40 crore marginalized people of the country, and the beneficiary will be identified by the socio-economic caste census. It will cover insurance of up to which is 5 lakhs per family. There is no cap on family size. It will meet out-of-pocket expenses and catastrophic health-related emergencies to the poor sections. Issues with the scheme. So the allocated amount is less, that is 20,000 crore only. So allocated fund is mainly amount is less than 20,000 crore. So it is mainly issue and need more money. The primary health sector is neglected. Some states, if they have not yet joined the scheme, some states and UT have yet not joined the schemes like Delhi, Odisha, etc. Way forward. So thus there should be no cap on the number of scheme. There should be no cap on the number of the scheme provided hospitals in districts, so that competition decreased in premium. Swachh Bharat Mission should be incorporated, maintain the hygiene and management of garbage, prevention of disease, and use of artificial intelligence and technology to early detection and cure. Make healthcare provider access accountable. Incorporate more private players. Pradhan Mantri Jan Aarogya Yojana is indeed a leap towards India achieving universal health coverage, but government should ensure that along with affordability, accessibility and availability, credibility is also achieved. But here first is the question mainly wants explain the initiative and examine the issue is critical for the scheme success. How to success? How we can improve the scheme? So here important things is here we can improve our schemes like Ayushman Bharat and National Health Protection Mission, and here you can improve money, allocate high amount of money, and improve primary health care system, and district hospital you can improve So it is here government should take universal health coverage for to account for affordable or and accountable and accessible to all people. So it is the answer. You can see Pradhan Mantri Jan Aarogya Yojana. So thank you.